All right, it's Q&A time and we're back to answer your questions. I'm getting some of the most popular asked questions about fertility, miscarriage, your menstrual cycles, and getting pregnant. If you're excited about this, then please make sure that you like this video. Leave a comment below letting us know what you think about the questions asked, and if you have any questions, please also leave those below. And make sure to subscribe to get the best fertility tips so you can get pregnant fast. In case you're new here, Fertility TV is the place to be when you're trying to get pregnant, improve your health, and get to the root cause of your fertility struggles. I've helped thousands of women improve their fertility and get pregnant over the last 20 years that I've been a natural fertility expert. I've helped them by finding out what's not letting them get pregnant, developing a personalized fertility plan for them, and giving them ongoing support while following the plan and improving their health and fertility at the same time. To make it easier for you, I've created a free guide that you can download right now to take a look at the 7 steps that you're going to start to change to empower your fertility from home. Totally free. Download it right now using the link in the description below. So I think it's Elizabeth who says, I'm 40 and I'm going through my 4th missed miscarriage. I'm sorry to hear that. No miscarriage is fun, but having 4 missed miscarriages is really difficult. Each time the miscarriage happens earlier, 8 weeks, 7 weeks, 5.5, and now 4 weeks. Is there something to this? You know, that's really interesting. There's a couple of things that I would think of here. Now, if they haven't already begun to want to do some additional testing for you, then I would say that's for sure where we need to start. We need to do some ongoing testing focused on your immune system, focused on blood clotting factors, and in addition to that, implantation failure. I know this doesn't quite seem like implantation failure, but that early one, that 4 and even maybe that 5.5 week one, I would say could technically be called implantation failure. So I definitely think we need to look at those areas. I also have questions for you, which unfortunately you can't answer right now, but I would ask a follow-up question is, have you had any successful pregnancies? Because that might impact how we look at this as well. This is challenging and we need to definitely get to the root cause here so that we can get a better understanding for why this is happening. One thing that's often overlooked, I should say that differently, is male factor here. I know that's going to get dismissed because you've actually been able to fertilize the egg and get pregnant, but I do think that that has to be something that needs to be ruled out as well. And I would recommend for him at least a semen analysis, but at best also a DNA fragmentation test with that so we can get a clearer picture there. Those implantation failure tests are going to be biopsies of endometrial tissue that really should be done at a fertility clinic as well. So those are my thoughts on that. It's really difficult to know why this is happening, but I do think we need to dive deeper to figure that out. All right, this next question comes from Sarah. Hello, doctor. Do you know if having a too high level of B12 impacts fertility? It's at 800 at the moment, and I believe the max recommended daily value is 500. Thank you so much for all your videos. I wish I was in San Diego. So I'm actually going to comment on that last part first. Thank you. I appreciate that you watch the videos and that they're helpful for you, so I'm glad that's helpful. You do not have to be in San Diego to work with me. I work with couples all over the world through my Hope Fertility Coaching Program. If you want more information on that and you want to apply to qualify to see if we can help you and speak to a real member on my team to dive deeper into your case and learn more, then go ahead and use the link in the description below. We can support you where you are, Sarah, even with everything that you're going through. But to support you right now on this question is, I actually don't think that your B12 is that high. I often see B12 much higher, and if we're supplementing, that's a real reason why we would see B that high. The recommended value, the reference range here, is a bit outdated at 500. We want it in that range at least, but I'm also very fine. B vitamins can be definitely, especially this one, B12, can be higher like it is for you without any consequence. And you might actually need it to be this level to get what you need out of it and to help with methylation. So I'm not overly concerned with this. I would say to you that just make sure you're on a methylated B12 or methylated B complex. I think that's going to be better suited for you as well. By the way, I know that for Sarah, I recommended that regardless of where she is, she can join my Hope coaching program. This is exactly what I do with the members in the program. Every Thursday, we talk live one-on-one in our group coaching call. So someone like Elizabeth in the first question with all her miscarriage questions, you know, we would have this conversation about what the next steps are and what testing she needs to do. Someone like Sarah here who has her B12 question, we would answer that every Thursday as well in my group coaching program where we support all the members on a regular basis. So this is something that if you want more support on and you want more guidance on your journey, and you want to see if we're a good fit for you, again, just like I recommended that for Sarah, I'm going to recommend it for all of you. Go ahead and use the link in the description below to apply and see if we can support you on your fertility journey. Now, the next question is, trying to get pregnant with one tube, is it possible, doc? The short answer is absolutely, it's possible. It can be harder, it can take longer, but it's 100% possible. And that's something that I want all of you to recognize. Just because you have one fallopian tube, and I don't have my little stuffed doll here about the actually I can see it over there and I don't want to get up to get it while we're talking, but your fallopian tube, as long as you have one healthy fallopian tube on one side, if you're ovulating from the other side, it can cross over, come over and try and grab that egg for you. So you can do it. Often I do find it takes longer, it's a little bit harder, and so that's just something to consider, but it is definitely possible. We want to make sure that that other tube is open, so you do want to make sure that that's the case and just give it a little bit of try. Okay. All right. So this next question comes from, I can't help but say her name, Hippie Panda. Hey, I like it here. She says low AMH in 2018, but managed to conceive via IVF and gave birth to a healthy baby in 2019. Now I'm 40, trying for number 2. Doctor prescribed CoQ10 1200 mLs per day, vitamin D, folate, and DHEA. I'm also overweight. He wants me to lose at least 16 kilograms in 3 months. Obviously, that's not safe, right? So I've got a couple things to say here. The first one, which was the actual question that she asked, which was, it's not safe to lose that much weight in 3 months. If it's done properly with the right support, I think it can be okay. But I look for you to drop 1 pound a week. And so if you've got 3 months, 12 weeks, that's 12 pounds. I think that's totally doable. You might even do a little bit more, maybe 1.5 pounds. And so you could probably bump that up. With that being said, you conceived with low AMH before. You can do it again. Now, I understand you used IVF before, but that doesn't mean you can't get pregnant now for number 2 with your age and your AMH level. So believe in that. With the supplements that you're taking, I'm fine with the CoQ10, although I think the dosage is quite high and unnecessary. And I'm good with the vitamin D and folate. DHEA, I'd be a bit hesitant here, especially if you are overweight. I think it's going to make it harder for you to lose that weight. And I'm not even sure if it's necessary, especially if they haven't tested your DHEA levels. For anyone who works with me in my coaching program, we never, ever, ever recommend DHEA unless we've had those hormone levels tested and we know what they are, so we can know what levels to recommend. My guess is she was told to be on 75 milligrams, which is probably way too high. So we want to make sure you get tested before you get on DHEA. I have many videos on this topic. You could search the YouTube channel for those, but that is something that I think needed to be mentioned, which is why I wanted to highlight it here. But good luck on your journey. I believe in you and do believe that you can conceive number 2. So good luck. The next question here says, is it possible to conceive naturally after multiple miscarriages? I've had 3 miscarriages, 2 had gone itself, meaning I think it passed naturally, and 1 was a missed abortion within 2 years. The doctor told me that there's only a 50-50% of getting pregnant or having a miscarriage. What should I do? I think you should continue to try. But just like I mentioned in the beginning when we talked about miscarriage or addressed that other miscarriage question, I think you need answers and I think you need support. So first and foremost is do more testing. If you've had 3 losses, then what could be the cause? If you're not going to do anything to address the underlying root cause, then how can we expect a different result? So we do need to do some additional testing, just like I mentioned for her, at the very least, immunological testing and blood clotting factors and testing. So those would be the 2 at the top of the list. And if you haven't had all your other hormones and labs done, then I do recommend checking those as well. 50-50 is not bad. So don't think that's a bad thing. It just means that they don't know if you can or can't conceive. And so they're just saying, well, I think it's a 50-50 chance. Most of the time at your best in terms of conception and having a healthy pregnancy when you're 20, you have at best a 25 to 30% chance. So 50-50 is just fine. Don't think of that as a negative thing, but I do think you need to get the proper support so that you can find out what's going on here and make the proper and necessary changes that will get you the results that you're looking for. All right, I'm so enjoying answering these questions. And this next one kind of ties into the last 2 of the questions that we've had around a miscarriage. So this one says, it's from Shannon. She says, thank you for sharing. Can you do a video about getting pregnant when you have autoimmune disease issues, inflammation, cell issues, etc.? Well, absolutely. First and foremost, I have done these videos already, so you can look at the YouTube channel, Fertility TV, check them out. They might not be listed like this, but they would be under miscarriage or recurrent pregnancy loss and maybe even implantation failure. So autoimmune disease issues are common with recurrent pregnancy loss. So we do see that unfortunately often with pregnancy loss and miscarriage, which is why I've mentioned it before when we're talking about that. In addition, inflammation is something that can also be an issue. Inflammation is necessary, or a little bit, that inflammatory response for implantation. But if we have too much inflammation, it causes all sorts of problems. Some things we don't think of as an inflammatory response is: one is thyroid issues, two is metabolic syndrome or metabolic issues, blood sugar issues, diabetes. These are all inflammatory responses, also potentially immune responses in the body that need to be handled as well. Inflammation comes in many, many ways. Endometriosis can be inflammation, so we need to understand what you mean by inflammation so that we can better support you and answer your questions. But absolutely, inflammation will impact it. Coming back to the autoimmune issues, yes, thyroid issues are the most common thing that we'll see. Not all thyroid issues will lead to miscarriage, but autoimmune thyroid issues can definitely lead to a pregnancy loss. And then there's other immune issues that can also be issues for holding on to a pregnancy, like lupus, RA, NK cells. These are some common things that we typically see. Now, I don't know what you mean by cell issues here, so unfortunately I can't ask you, but if you mean like cells are degrading or not as healthy or strong, then yes, absolutely, those can all lead to fertility issues. So we want to support all these things, which is why it's important to dig deeper and get more answers, and hopefully that helped you out with your question, Shannon. All right, one more here. She says, in April of this year, I found out my AMH was 0.073. I've been tracking ovulation and trying for the last 3 years, and I can't afford fertility treatments right now. So I'm just going to try until I either start menopause or until I'm able to get enough money to get help. Thank you for your videos. I'm not losing hope. I'm also 43 and my partner is younger. I think your determination is amazing and awesome, and I want to see you continue to do that. I would rephrase what you said. I'm going to keep trying until I either start menopause or I'm able to get enough money to get help. I would add a third thing. I'm going to keep trying until I get pregnant. Or if I keep trying and I'm not pregnant, then I head into menopause or I'm able to generate enough money to get the support that I need. I would word that differently for you. Your words are powerful. They mean a lot and they can change so many things. So let's rephrase that, okay? I do believe that even though your AMH is 0.073, as I've mentioned before in previous videos, that you can get pregnant with that number. That number is more important for IVF than it is for you to try naturally. And as long as you are having a regular cycle, you are ovulating regularly, and you're able to have regular intercourse and timed intercourse around ovulation to achieve fertilization, then you can get pregnant. So let's keep that going. But there's tons of things that you can continue to do for free, one of which is watching these videos. Another one is downloading my free guide that I talked about before this video started, or in the beginning of this video. So keep your hopes up, stay with it, start to make necessary changes on your health so that you can get the results that you deserve. All right, thanks for watching until the end. Again, I want to remind you to post your questions to get a chance to get them answered just like these were answered in this video. Sometimes I'll answer those questions below this video in the comment section, and sometimes I'll save them just like I did for this one so that we can answer them live or on a video like this. If you really want to go deep into your fertility, find the root cause that's not letting you get pregnant, be sure to fill out the application to find out if we can support you. And you can do that by using the link in the description below. This will allow you to speak to a real human on my team so we can identify if this is the right next step for you and see if you are a good fit to join the Hope Fertility program. Now make sure to check out this next video right here to keep learning more about your fertility. Until the next video, stay fertile.